You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, nutrition, and sports performance. Stay up to date and listen anywhere, anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your hosts, Dr. Justin Marchegiani and Barris Harvey, as they answer your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marchegiani, and welcome to another awesome episode of Beyond Wellness Radio. We now have full podcast transcriptions over at justinhealth.com. Head over to justinhealth.com, click on the podcast button, and you'll be able to access all shows forward and past. And while you're there, feel free and sign up for the thyroid and hormone video series. Some great information there for everyone. And while you're there, you can also sign up for the podcast newsletter, where you'll get access to these podcasts right in your inbox before anyone else. While you're there, you can also schedule a consult with myself if you want to dive into any other functional medicine or health issues. Again, stay tuned for the show. And if you're enjoying it, please feel free and share it. Sharing is caring. Think of one person that could benefit from this show and share it. And also, feel free and head over to beyondwellnessradio.com/iTunes and send us a review. We really appreciate it. Thanks, and enjoy the show. Hey there, it's Dr. Justin Marchegiani with Beyond Wellness Radio. Today we have a super awesome guest talking about an awesome new service and product that I think everyone listening to the show should be interested in. I'm interested in it, and I'm going to be using it with my patients to help provide better service and to help organize all of the lab data that I'm bringing in for my patients. But I'd like to welcome Dave Korsunsky to the show.
Thank you, Justin. Happy to be here.
Awesome, Dave. Well, why don't you tell the listeners a little bit more about yourself and how your life kind of wound up here?
Sure. Well, I was working in Silicon Valley for a huge software company and found myself struggling with stress and fitness and just overall health and wellness and personal performance. And so that just set me down a path of starting to look at other ways to optimize my health. And I guess it first started when I discovered biohacking, started reading some of the material on Bulletproof Executive and started devouring that type of information and started working and consulting with experts like yourself. And it really just took me in an entirely new direction in terms of how I thought about my health and how I thought about managing my health. And over the years, as I've become more informed, what I realized was that there's a real lack of tools out there for individuals who do want to take more control over their health and do want to become empowered. We just need more effective tools for doing things like managing all of the different files, all of the different lab results, all of the different data we're collecting ourselves. And so, largely born out of my own frustrations, I decided to put this product together. And with support from a lot of great people, including yourself, we're at a great point and we're close to releasing it now.
Yeah, I'm really excited for this software because it's going to really take everyone's health data and organize it and literally put it at their fingertips. It's going to give people the ability to kind of see, the difference between their labs, from this year to last year via that color coding technology that some lab companies have brought out to make things more visual. I mean, I could think to my first consultation with you, Dave, and you came in with stacks of lab works, Excel sheets upon Excel sheets, and we're trying to look through things and look at trends and kind of, roll up our sleeves and dig into the data, and it was tough. And I think, this thing that you've created and you're kind of bringing about here is going to make it easy for the biohacker, because all these biohackers, they're just as serious as you, collecting their data, testing, quantifying. But not only the biohacker, it's going to make it easy for the physician that's trying to, come up with the action plan of how we're going to move forward to achieve this goal.
Yeah, that's right. And just thinking back to some of those days when we were working off of a spreadsheet, I think like many people, I've lived in more than one city over the years, more than one state. In fact, in my case, more than one country. My records were everywhere. And so one of the first things I did when I wanted to start improving my health was I just went out and tried to collect them all. And some of the records were coming in on paper. Some physicians were just mailing me a CD with a PDF file on it. And even within the San Francisco Bay Area, I'd seen a few different doctors. I've got labs at Stanford, I've got labs at UCSF, and I've got labs with my GP at St. Mary's. none of those medical facilities were able to allow me to centralize my records, even though they're all using the same software program on the back end, most of them anyhow. And then, just to make matters worse, I just went on to the Affordable Care Act, switched to a different physician because my old physician didn't take my new insurance and had to go to another doctor. And so now I have labs in a fourth medical facility.
Oh, man.
And then working with yourself, you would just give me the lab reports. I'd go to Quest and get a PDF file. So I had all of those documents. So the first thing we did was, how do we get all of the medical records in one place and basically get away from the spreadsheet? And so what we're doing that's very unique is, first of all, we can automatically connect already to over 500 medical facilities.
Wow.
All we need is your login credentials. We automatically download all of the data. Or if you have historical data, it's very simple to just log in, enter your historical records, and soon we'll also be able to offer a service where we'll be able to help people with this. So we hope that it's going to make things a lot easier for people to just centralize their records and then actually just consult with whoever they want because they have everything available to them at their fingertips.
That's great. So there's going to be ways to look at also the standard lab range that's there to help pick up pathology or disease. But from what I understand, there's also going to be ways that people can look at their functional lab ranges and maybe look at things from a functional standpoint too. How's that work?
Yeah, we realize there are different reference ranges out there depending on what type of specialist you're consulting with. And so we're working on features where we will have standard lab ranges in there, which can be used broadly, or you will also have the ability to enter functional ranges in there. For example, just talking with some of our beta testers, they're working off of a lot of the thyroid markers that are much different from traditional MD ranges. And so you'll be able to enter your own ranges and we'll automatically adjust the color coding and the ranges based on whatever you deem is appropriate based on how you're working with your physician. So that's something a lot of people have been asking for, and we're very close to having that feature working.
That's great because a lot of people, especially being someone that specializes in thyroid issue, we look at a lot of thyroid issues, but the conventional setting are typically using labs like TSH, and they're using a very high lab range where we can have patients come in that will get the TSH done, but we'll use a more sensitive lab range, and we'll be able to pull in data like T4, T3, RT3, and thyroid antibodies, etc. Is that correct?
Yeah, and that's one of the things that you helped me with personally. And so I'm equally passionate about making that same thing available to everybody. So yes, all of the thyroid markers will be there. The reference ranges can be customized. And so yeah, all of that stuff will be working.
Well, I'm so excited because this will make my job easier as a doctor to help patients and then also really drive home that complete picture, because I love some of the color coding stuff that you showed me as well, kind of, the green, the red stuff, so you can see when things are starting to get out of range. I think it's important to have that color coding feature to add that visual element.
I agree, and I think one of the other really important things, as I'm sure you can attest to, is, okay, great, we have all of the clinical data in one place, but what happens on the day-to-day situation as well? So for example, I am collecting a lot of data on my own. Within the healthcare industry, there's a lot of talk right now about patient-generated data.
Yeah.
And that's what happens between doctor visits, those months that go by, and people are starting to collect incredibly valuable data on themselves through a lot of emerging technology. And so whether I'm tracking my basal temperature every day for thyroid or weight or glucose or blood pressure, all of that lifestyle data, even nutritional data from things like MyFitnessPal and other software apps and wearables, sleep data, for example. So we also made it possible to incorporate all of the lifestyle data and all of the clinical data in one place. People typically keep those things discrete, but they're actually one and the same. And so it was really important to integrate all of that information as well. You've been helping me develop a lot of these features, and so we're equally excited about that part.
That's great, because right now I have my Fitbit in front of me. I have my blood sugar meter, my ketone meter. I have a PDF where I have my FitnessPal that keeps track of maybe calories or macronutrient ratios. And from what I understand, we're going to be able to combine everything together and put all of the data in one place.
Yeah, that's absolutely right. So for example, you'll be able to plot trends to say, is the information on nutrition coming in from the mobile app, MyFitnessPal. How does that correlate to data about my glucose, which is
Wow.
coming from my glucometer? So these have typically been completely disconnected data sets, so there's never really been a good way to look at it like that. And so by having all of the information in one place, we can start to provide some very powerful analytics that people can use to study their health, and then also as an education tool, and then to consult with their healthcare team as well to view all of this stuff together. So exciting features.
Wow, that's great. So if I have a blood sugar, a blood pressure cuff that's
hmm
Bluetooth, that will also hook up too.
Yeah, we set it up so that you can use a lot of the Bluetooth devices. So if you have a Bluetooth cuff or a Bluetooth glucometer or a wireless scale, all of that stuff works, and it will automate the process of importing the data so you don't have to enter anything. But we also realize a lot of people don't have the time or the money or even the desire to work
Right.
with all of the fancy stuff. Like me, for example, I have a Bluetooth cuff, but actually my old school Omron one, which isn't even wireless, is actually way more consistent. So
Mm-hmm.
I can use a manual glucometer or a manual scale or cuff. All of the stuff can be entered manually or using some of the wireless technology. So we support both use cases.
That's great. So how does it work? If I have like a 5-page blood test and I don't feel like spending the time punching each value in, how does that work? How do I get that done?
Yeah, that's a great question. So we're very close to launching our concierge service. And so that will be for individuals who don't have the time or the desire or the expertise to sit down and enter it all in, which can be tedious, especially for users that have 10, 15 sets of labs historically, like some of our beta testers do. We will have a service that can help with all of the data entry. So we take whatever source, whether it's PDFs or however you've been recording your history, and concierge service will just help you get it all into one system, and then you just end up with something that has everything in front of you. All of the information will be there, graphs will be there. It's all very user-friendly. It's all engineered around the end user using interfaces you're very familiar with as the consumer and as a user of technology. Unlike a lot of healthcare systems, which are still using a lot of legacy software, we've engineered this to be very user-friendly, very engaging for the user, and you just get everything right in front of you.
That's great. And I see there's a video here on Vimeo on the Heads Up Health, just kind of a nice little info video on how everything kind of flows. So we'll put that in the show notes too.
Yeah, just a really quick explainer video of how it works. It's also on the website, so just in under 2 minutes you can get a sense for what it is we're trying to do. This software has been something that was transformational for me in my own health, and so I'm incredibly passionate about making this available for everybody.
Yeah, I'm really passionate about getting it out there for my patients, but I'm also really passionate about getting it out there for doctors because it will make the doctors' lives so much easier, kind of plotting out goals and data and really helping to create an action plan that really encompasses all the data.
Yeah, I agree. My sister is actually a naturopathic doctor in Canada. Experts like yourself who are in the functional medicine realm, I think one of the challenges, and correct me if I'm wrong here, is you don't have access to the patient's electronic health record because that only exists with the MD or the health system that has that data set. And so we believe that the individual should have their information. So you could envision patients who show up to you on day one and you have their entire history available. And so we hope it will be very valuable to experts like yourself.
Yeah, and it's nice to be able to chart that stuff down. It's there. The patient can kind of see it too, so they kind of know what's going on, so they are kind of, in the loop with what's happening in the process.
Yep, agreed.
And then what's the full website again, Dave?
It's headsuphealth.com. And right now we are in a small limited beta, so we're adding users very slowly. People can sign up at the website and we'll let them in as soon as we have room. We're growing very slowly. We want to make sure our performance stays really strong. We want to make sure all of the features are stable. So we're growing slowly and all of the information is available online.
That's great. So can we do a screen share for everyone at home just so they can take a look at the podcast via the YouTube and they can kind of see how this looks and feels?
Yeah, that sounds great. So I will go ahead and share my screen here with you so that you can see this, and I'll just step through some of my own data and show you how it works for me as the individual. So let me know when you see my screen come up, Justin.
Right. All right, I got it here.
Cool. So this is what I see every day when I log in, and this is the information that's most important to me. And everyone can configure this dashboard differently, but think of this as your vital signs. And so the first thing you set up is, what are the most important metrics for me? In my case, it's data around body composition. So each of these tiles on the screen here is coming from a different data source. Some of it might be coming from my doctor's office or my electronic health record. Some of it might be coming from a wearable device or an app. Some of it I might be tracking manually. So you can see the first two tiles are coming from my Withings scale.
Yep.
My BMI automatically gets updated based on my weight and height. You know, in the middle row, actually one of the most important metrics for me is my sleep. I notice a huge difference in my work performance on the nights where I get 8 hours versus 6 or 7. So I'm using the Misfit Shine. It's a device on the wrist, similar to Fitbit, but just slightly different in terms of battery life and the way it collects the sleep data. But this one is probably the most important for me performance-wise. So here's just a 7-day trailing history of my sleep. I'm at about 7.4 hours. And I sit at a desk all day, like many people. So this one here is just making sure I get up and go for a walk or a run every day and staying physically active.
That's good.
And so here's an example of something I'm tracking manually, my meditation time. That's not coming from an online source anywhere. I just enter that data in, so I can just give you a quick shot of how that would work. So if I want to enter my meditation or my glucose or any metric manually, I can just enter that in here. 25 minutes, it was mindfulness, add some notes, XYZ, and that data will show up as well. So this is just my vital signs, and if I was tracking basal temperature, you can see I can just add basal temperature to my dashboard, which I was testing. Right. So that's the vital signs, and I think in this day and age, Justin, a lot of people think of vital signs as what you might think of at a medical office, but I think of vital signs as, am I sleeping enough? Am I moving enough? And so vital signs in the digital health era, I think, are more around metrics like those ones, as much as they are around heart rate and blood pressure, for example.
Absolutely, and there are some things like maybe your doctor may have you run a functional glucose tolerance test where you run a eat your breakfast and then chart your blood sugar for the next 3 hours after that, where you could maybe add that element in too, right? A 1 hour, 2 hour, 3 hour after your
and that's something I do regularly, just testing different meals and their effects on my blood sugar. So for example, one thing I've been doing is entering glucose after different meals, for example. So you can see I can enter a reading as fasting, 1 hour, 2 hour, or 3 hour, or put the exercise or medication tags on it. And what that allows us to do is I'll just show you how the graphing engine works, where I can actually just look at my glucose, for example, and you can see here I can actually toggle between the 1 hour and the 2 hour and the 3 hour, and even graph it against other sources like exercise. But you can see from my 1 hour readings, it actually, if I move the mouse over each data point, it shows exactly what I ate, so I know which ones spike it more than others. So that's how we're doing a lot of the graphing work in addition to just the raw data collection.
Yeah, this is very, very Apple-esque, super easy, user-friendly. And can you show people how the food diary part works? I know you just got an integration with MyFitnessPal, I think.
Yeah, that we just actually finished the integration, and we're just building in the features to bring in that data. So that's not something I can show you today, but that will be working within the next week or two. So the MyFitnessPal data will integrate here. It will actually just show within the analyzer here. I'll go back to that for a moment. So it will show up as another data source. It will show up under nutrition, and then you'll have total calories, macronutrients, and those can be plotted as well, for example.
That's great.
So this is the labs, and this is my own data. This is all of my records for the last 10 years. Some of these are coming in automatically through connections to UCSF. Some of them are coming in from labs that you've had me run, which were entered manually. But the main thing is I have all of my history here, even though this information is probably scattered across 4 different doctors' offices and 10 different PDF files. And so I get everything in one place. Here's my total cholesterol. You can see the difference just going on and off. Paleo, for example, how some of the diet affects cholesterol. These are things I can trend and track myself. So when you have everything in one place, you get a lot more insight into yourself. I've probably got 6 more years of history in here than any one physician. So that's the power behind integrating this all into one specific system.
That's great. And is there a certain section here for notes at all?
Not for individual biomarkers per se. That's something also that we're thinking about adding. So if I wanted to flag a particular reading with just some of my own personal notes, that's something we just got a feature request for, very easy to do, and so we're looking at adding that. But that doesn't exist today. It's something we can easily add as we go.
How about just a section for notes for maybe a person just trying to write about how they're feeling on a certain day, or a doctor coming in there that wants to make some notes on maybe some stress factors or something else they want to add in?
Yep, it's a simple journal feature, and it will just be in here. There'll be a place to add journal entries, and so that will be a place just for adding notes.
And so if you're your file here, and you'll say you bring another nutritionist or an acupuncturist on board, and you want to let them have access to your file, how does that work?
Sure. So it will be simply a situation where you'll be able to invite them into the profile. You'll be able to control which permissions they're able to see, and then authorize or deauthorize that individual at any time. But in my case, for example, as I mentioned, my sister is a health professional. I want her looking at my data. I want yourself to have access to my data. I would also like potentially an MD or other people on my care team to have access. That's a very difficult thing to do, and we're doing it all in ways that are fully HIPAA compliant. So it's challenging, but we'll have that available. And so the goal is that you'll be able to have your whole care team collaborate with you around your information. And so that's the vision.
Yeah, my wife had a family member that got injured this last winter, and while she was in the hospital caretaking, she noticed the physicians that were coming in and out of the room. Literally, there was virtually no communication between them, and there wasn't a streamlined system to keep information, at people's fingertips. So it seems like maybe maybe certain hospitals, they have a software like this for that hospital.
Correct.
But once you step outside of the hospital, there's nothing to really cohesively unite the information with the healthcare providers.
Agreed, and I think for many people, the care team is family members. It's different healthcare experts, whether it's functional medicine or nutritionists. It's often people within the medical system, and so with the patient in control of the data, they can then share it across all of their different stakeholders, and that's something that is really important to us to be able to support, and we're working really hard to get that ready as soon as we can. Just a couple other things. It's very important to keep all of my files in one place. I know you've run a bunch of different tests for me, everything from adrenal health to working on some of the digestive stuff to my labs from different MDs. So these are all stored here. We store them in fully encrypted and HIPAA compliant data storage online. Here's my immunization record. I can send that wherever I want. If I'm on the other side of the world and I need this information in a medical situation, it's all right here at my fingertips. And then other information just around things like vaccinations and health and medications and supplements. So it's really just meant to be your complete traveling profile with you whenever you need it. The ability to share across your care team and the ability to centralize all of your health data. That's what we're aiming for.
That's great. So if I'm a patient and I'm trying to, get at this is great. I want to organize my data. What's the next step do I have to take to get access to this?
Well, I think the first step is registering online, and then our beta program is open. We're growing in very small groups, as I mentioned, just to keep the performance good and make sure we don't run into any issues. But once you're logged in here, it's very simple. First of all, it's linking up your medical facilities. If you have a supported medical facility, we can automatically import the data. It's connecting any digital health technology you're using, a wireless scale, a glucometer, a cuff. It's setting up the different data that you track on your own, as I mentioned, everything from basal temperature to meditation time. So once all of the data is in there, that's really about it. You can start using the software and start maintaining your complete history. It's very straightforward. There's not a lot of complexity in here. There's 4 main sections, a way to add data and a way to connect your data sources, and then ultimately a way to invite your care team to collaborate. And so it's very straightforward and easy to use and very intuitive.
That's great. And if I'm a doctor or a healthcare provider that wants to start utilizing this software for my patients to help organize their stuff, how would I do that?
Well, I think yourself as the physician, it's simply a matter of directing the individual to create their account. I think
Got it.
typically all of your patients will have copies of their labs already, or perhaps you're also maintaining copies, as you are in my case. And
Yep.
so the first thing would be at least getting the most recent set of labs in there. And then over time, perhaps the historical ones could be entered in. And then yourself working with the individual to say, here's the 4 or 5 things I need you to keep an eye on. I need you to keep a food journal for a week. I need you to track basal temperature for 2 weeks. And so you guys can just configure the software based on the intended treatment plan at that time. And then as the individual moves on, the information travels with them. And so that's how I would envision it working between physician and patient. And so when I meet with you, for example, we'll just be doing that exact same thing. In fact, I have the most recent labs you ran for me a few months ago here, and we reviewed those together. And so that's how I envision it working.
Got it. And it's interesting, just 20 years ago, it was hard for a patient to even get their lab work from their doctor. The doctor would just say, hey, I'll call you if anything's wrong. And if nothing was wrong, you never got a call. You never really got the labs. And now everyone's requesting their data, and they're not even just going with the doctor's lab ranges. They're going outside the scope into a functional medicine doctor's range, where they're looking at the functional ranges. And I love how you kind of have the best of the conventional side, but you really add that extra filter where people can go above and beyond and really kind of set the bar higher and look at their health from a finer tuned perspective.
Yeah, I completely agree. I think it's a very exciting time because by law, everybody now has access to their medical records, electronic access to their records. And so people want this information. People are saying, I want this extracted from all of these different facilities where it never gets looked at. And I know one of the things that was most helpful for me was getting all of this information in one place, and it was incredibly insightful. A lot of these tests I'd never even heard of before, but it encouraged me to look at them and educate myself and ask more questions and consult with different people. And what's more exciting is that in addition to just having access to our records, these medical facilities are now starting to provide access to it through developer APIs. So as I mentioned, we can automatically download the records, which means less work for people having to enter historical data. So we're moving in a direction where all of this information can start to be used for the individual in ways that are very empowering.
Cool. This is great. So anyone that's got a blood sugar meter or a Fitbit, or is doing some kind of work charting their food, or just wants to keep track of their historical data from year to year or quarter to quarter better, this is going to be the easiest way to do it.
Yep, agreed.
Well, any last closing words here, Dave?
No, I would just say thanks for the opportunity to be here, Justin. It's an honor, and I enjoy working with you as a colleague and a professional, and also as an individual who's been incredibly helpful in my own health journey over the last couple of years. So thank you.
Well, thank you, and I'm just so excited to be part of this technology that's going to help people really put their health back in their hands.
Yep, wonderful. Thank you, Justin. If anyone has any questions, they can contact me directly, dave@headsuphealth.com, or track me down through yourself, Justin, or through the website. So thank you again.
Thanks, Dave.
Got a question for Dr. J? Go to beyondwellnessradio.com/question. Then tune in to hear the answer. Also, if you like the show, review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.